name is Ed Shahady, and we're here at the Cardiometabolic Risk Summit in Las Vegas, Nevada. And with me is Dr. BenTaylor, who's a professor at Augusta University, Pearson Williams Medical College, Georgia. He just told me to keep changing the names to confuse everybody.
That's right.
Ben, you're going to be doing a presentation here this morning on prediabetes, identification, treatment. Would you tell us a little what you're going to say today?
So me and Dr. Drago, we're going to be talking about prediabetes and how it affects individuals. And I'm doing the portion on screening and early testing and identification. And we all know that diabetes is such a big thing in the United States. And I always joke with my patients, I always say, I'd rather probably have HIV than have diabetes, since diabetes just affects everything.
Wow. And you would say you'd rather have HIV?
Well,
why is that?
Well, because, HIV has a cure now.
Okay.
And people are living longer. People are living much longer with
Right.
it. But with diabetes, there's so many different complications of it and such, and that it just affects the whole body. And so with pre-diabetes, we're trying to stop that at the early junction, because we see, if you look at children these days, when we were growing up, what did? We went outside and we played all day. So we were out ripping and running, so we didn't have all this obesity. But now we have these young kids that come in. I saw a 10-year-old the other day weigh 230 pounds. Wow. 10 years old, 230 pounds. That is just too much.
Was he diabetic?
Yes. And what is he doing at home? Video games. So they're not getting out exercise, and they have hypertension, and they've got the centrifugal obesity going on, and they're eating all the wrong things. So
how do you address that? Because I think that here we are now, type 2 diabetes is appearing in adolescents. Before we talk about treatment, how do you try to prevent it?
Well, in the practice that I worked in this family practice, I have this very extensive program that we use over there. They have a checklist of things that I want the patients to do. If they're diabetic, they're starting off with their eyes, and we send them to ophthalmologists and stuff like that. If they go to a dietitian, so we can get them on some proper health. And even in South Carolina, because I also work in South Carolina, there's a program called the Healthy Outcomes Program, which helps people that don't have a lot of money get into all these programs. And actually, the state is actually funding this thing, and it's helping. It has helped a lot of people. My biggest thing, I try to guilt everybody. If you can guilt them into doing.
What do you mean by guilt?
Well, if it's in younger people, you have to kind of bribe them. Say, look, if you start losing weight now, you'll be able to play football, you'll be able to get all the girls, you'll get all the girls, so you just say that.
Motivations for adolescents.
In older people, if it's a man, because men, we tend to come in and not tell everything. So if it's a man and he has a daughter, I ask him this one question: do you want to be there when your daughter walks across that's either that wedding stage or the graduation stage? And for the most part, they start tearing up and they cry. So if we can start them at an early age, it's more effective.
So you motivate them to probably want to exercise, eat. Now, some of these people coming into it already have got some of the comorbidities that go on. They're hypertensive, maybe they're hypoglycemic already. What medications do you use in that age group? Because I think I got a 40 or 50-year-old, I've got a lot more options. I get a little bit scared down in that age group.
Well, if they have a whole lot of comorbidities, if they have hypertension, we can start them off at very, very low doses of lisinopril. But of course, like in African Americans, we don't want to use lisinopril. So we're going to calcium channel blocker. So we can use a very, very low dose of a calcium channel blocker, or even start them off on just something like hydrochlorothiazide. You start them off something like that. If they're diabetic, very, very low doses of metformin, if it's warranted.
Do you first try dietary or lifestyle?
Always.
You do a try lifestyle before you start medication. Does that work?
And I'd say about 20%.
Yeah, it's not as effective as we might for it to be.
It's not as effective.
What about if they have hyperlipidemia? Their LDL's certainly at a high range. Do you start a statin after lifestyle?
Well, the thing about statins, and we've talked about this in the past, is some statins, if you're not a diabetic already, statins can bring out that diabetes in that person. So you can start them off statin, but I typically tend to wait for a while before I put them on statins. I'm still going to push that lifestyle management. I'm going to send them to the dietitian and then have them come back very frequently so I can check on them.
How successful are you?
I'm very successful, actually.
Are you? Great.
Yeah. That 20% of the, if the patient's highly motivated, they do wonderful.
Right.
Yeah.
What's your trick? Why are you successful?
Because I'm a nice guy.
Well, I agree with that. But nice guys don't always come in first.
No, because when I talk to patients, I don't try to pretend like I'm higher than them.
Right.
I come down on their level, and we have this heart-to-heart talk.
Right.
And I'll sit down with them. I'll stand up over the room and stand there and say, you need to be doing this, you need to be doing that. I'm gonna sit down with you and talk to you like you're my cousin or you're my family.
Right.
And so that tends to help. So they always want to come back and see me. So they come back more frequently.
Sure. No, that's great. And I'm sure you're proud of your success.
I really am.
Well, thanks for sharing a few minutes with us.
Thank you very much.
Have a good conference.
Thank you.